Matt, let me follow up a little bit on that. You mentioned the experience that that OneDigital has. Every county in Virginia, we have 95 counties. All 95 counties have a different relationship experience with healthcare providers. And as a broker, OneDigital, as a broker of health services, tell me about the relationship you all have with the health insurance carriers, whether it be Anthem Blue Cross or United Healthcare or Aetna or Optima, a whole host of others. Tell me a little bit about y'all's relationship.
Awesome. Well, I'll take that one. So we work with 400,000 employees across the United States, and we are in every state right now. And as Matt stated, we grew by acquisition. And so the specialists that are working within OneDigital have had these relationships with the carriers for decades. And because of the volume of employees that we service, we have immense buying power. And it's enabled us to really carve out some special relationships. So, for example, the relationship that we have with Anthem, that we were able to partner with VACo and roll out the VLDP disability for public sector groups. That is one example. We also, not only do we work with the larger companies, the Cignas, the Anthems, the Aetnas, the Uniteds, Blue Cross, to your point, we really turn over every single stone as we are working with a client. And it's not a one size fits all. And what our clients really appreciate is the options that we give them. And so we also take a look and have relationships with some of the more boutique carriers, such as MedCost or Piedmont, which is also very well known, and they have a great track record in Virginia.
Sarah, we have several counties, some of our larger, more suburban or urban counties um, uh, are self-insured,
Yes.
with their health insurance. Do you all provide, as brokers, do you provide other services for those counties that are self-insured, maybe some boutique services that they may need?
Absolutely. And that's a great question, Dean. And that brings me back to one of your first questions of what we're truly seeing out in the market right now. After COVID, more and more localities are looking at their health insurance, and they're looking at different funding strategies. And that is where self-insured falls under. And so as we're working with a group, is to Matt's point, OneDigital is very data driven. So not only do we take a holistic approach, but we also look at the numbers and we look at the data. And so we're constantly trying to determine, does this group still fit being self-insured? Does this group maybe need to be fully insured? And we're constantly running those numbers, and we have our own in-house actuarial team and our data analytic team. And actually, a lot of the folks that work at OneDigital came from the Anthems, the Aetnas, and they like to say that they're using their powers for good.
Okay.
Helping us negotiate.